Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Receiving telephone-based support for medical care can help keep individuals with certain medical conditions out of hospital and reduce the costs associated with their medical care, according to research published in the New England Journal of Medicine. Here is some information about worldwide healthcare costs and their impact. Worldwide, over 150 million people each year suffer financial catastrophe because of healthcare costs. Another 100 million people are pushed under the poverty level by the need to pay such costs. Countries that fund their healthcare systems through such means as taxes or insurance are less likely to have citizens face this problem than those who largely pay for healthcare through out-of-pocket payments. Researchers from Health Dialogue Services in Boston randomly assigned nearly 175,000 individuals with medical conditions typically associated with high medical costs to either usual care or enhanced care groups. In both groups, the participants received specific criteria for eligibility to receive supportive care via telephone. The criteria were more lenient in the enhanced group, making them more likely to receive this support. The supportive care consisted of telephone calls from health coaches who instructed the participants about shared decision-making, self-care, and health-enhancing behavioral changes. After 1 year, more than 10% of those in the enhanced care group qualified for and received the telephone coaching, compared with less than 4% in the usual care group. The average monthly medical and pharmacy costs of care were nearly 4% lower in the enhanced care group than the usual care group, and this lower cost was mainly due to the fact that the enhanced care patients were about 10% less likely to be hospitalized. We spoke with Dr. David Wenberg, one of the investigators of this study, who offered some further insight.
Well-designed programs to support patients in decision-making, both from an informational standpoint, but also from an information standpoint, but also from a skill standpoint. The healthcare system is very complex, and for a lot of patients, and you can think about this in terms of yourself or in terms of your kids or in terms of your parents, that there's a lot of times when you just don't really know where to turn or what to do. And what this intervention is really is a telephone health professional who can help you understand how to better navigate the healthcare system so that you can make a better choice for you or your family in terms of if you have a symptom or a question or anxiety, do you need to go to the emergency room, or can you actually call and talk to a health coach who can then help you working with your physician. And what was the results we found in terms of that standpoint is that there is an appropriate reduction in healthcare utilization, primarily in hospital admissions. Most people's preferences, if they can, is to be treated in the outpatient setting rather than the inpatient setting. And this program shows that if you have a good health coach, they can really help you guide and navigate your way through the system so that you're less likely to be admitted.
Today's research demonstrates how simple, inexpensive telephone coaching can help improve health and save healthcare dollars for individuals with certain medical conditions. For Insider Medicine in Depth, I'm Dr. Susan Sharma.